Hello guys, so today's topic is external carotid artery. In my previous video I've mentioned about the common carotid artery and its divisions. It is divided into external carotid artery and the internal carotid artery. Now coming to the common carotid artery bifurcation, at the level of the thyroid cartilage, in the image you can see this is the thyroid cartilage. Can you see? This is the thyroid cartilage, this is the thyroid gland. At the level of thyroid cartilage, the common carotid artery is dividing into internal carotid artery and the external carotid artery. Now suppose this is the thyroid cartilage, okay, and the common carotid artery at the level of the thyroid cartilage, it bifurcates, okay. The internal carotid artery at the bifurcation has dilation. Make a note of this. This dilation is called as the carotid sinus, and it has receptors that regulates the blood pressure in the body, and it is innervated by the glossopharyngeal nerve, okay. Now between the bifurcation there is a carotid body, okay. Between external and internal carotid artery there is a body which has the receptors that regulates the chemicals in the blood, and this chemical is nothing, mainly it regulates the oxygen concentration in the blood, and this is called as the carotid body. The carotid body is innervated by the glossopharyngeal nerve and the vagus nerve, okay. Now coming to the first, in introduction you will write the source of the external carotid artery, that is the common carotid artery, the bifurcation of the common carotid artery, at which level it is bifurcating, and at bifurcation you have two structures, that is the carotid sinus and the carotid body. Carotid sinus regulates the blood pressure, carotid body regulates the oxygen concentration in the blood, okay. Now coming to the borders, you have the medial borders, the lateral borders, the posterior superior borders, and the anterior borders, okay. Now in the medial borders you have the hyoid bone, the wall of the pharynx, the parotid gland, and the superior laryngeal nerve, okay. Laterally you have internal carotid artery and the superior laryngeal nerve, okay. Posterior superiorly you have two muscles. Remember this as two muscles, two nerves, and one gland. In two muscles it is the styloglossus muscle and the stylopharyngeus muscle. In the nerve it is the glossopharyngeal nerve and the vagus nerve. The pharyngeal branch of vagus nerve, and one gland is nothing but the parotid gland. Parotid gland is also the medial border and the posterior superior border. Superior laryngeal nerve is also the lateral border and the medial border, okay. Anteriorly it is the skin, the superficial fascia, the platysma, the deep cervical fascia, and the sternocleidomastoid muscle, okay. So I'll repeat: medially it is the hyoid bone, the wall of pharynx, the parotid gland, and the superior laryngeal nerve. Laterally it is the internal carotid artery and the superior laryngeal nerve, and posterior superiorly it is two muscles, two nerves, and one gland. Two muscles is the styloglossus muscle and the stylopharyngeus muscle, and two nerves are the glossopharyngeal nerve and the vagus nerve. Vagus nerve, it is the pharyngeal branch of vagus nerve, and one gland is the parotid gland. And anteriorly, skin, superficial fascia, deep cervical fascia, sternocleidomastoid, and the platysma. Now coming to the relations, there are nerves that are related and the veins that are related, and also the muscles. The nerves are two nerves, that is the lingual nerve and the hypoglossal nerve, okay. Lingual nerve, hypoglossal nerve. In muscles there is again there are two muscles, that is the digastric muscle and the stylohyoid muscle. The digastric muscle and the stylohyoid muscle. In veins there are four veins, okay. The four veins are the maxillary vein, the temporal veins, superior thyroid veins, and the common facial nerve. Maxillary vein, superior thyroid vein, common facial vein, and the temporal veins, okay. Now coming to the branches. The branches of it are 8 branches. For the detailed descriptions of branches, see my upcoming videos, that is the superficial temporal artery, the maxillary artery, posterior auricular artery, occipital artery, facial artery, lingual artery, ascending pharyngeal artery, and superior thyroid artery. So these are the arteries. You can see in my upcoming videos the detailed description of it, and for mnemonic also you can see the